morning, Minister Lund, all departmental officials. Let me just establish, Ms. Jamke, am I audible?
We can hear you.
You're
Thank you very
audible,
much.
Chair.
Thank you very much, honourable members. It is Tuesday, the 1st of April 2025, and the Standing Committee on Social Development will be deliberating on the budget vote, vote 7 for social development for the 2025-2026 financial year. As I said, welcome to all honourable members. Welcome, Minister Lund, Dr. McDonald, the HOD of the Department of Social Development, all departmental officials and guests, if there are any guests present here this morning. I will now request members to kindly introduce themselves for the record. My name is Wendy Kaiser-Philander and I'm the chairperson. Thank you, honourable members. You may proceed.
Good morning, members and Chair. I'm Donita Stevens and I'm a member of this committee.
Good morning, Chair. I'm Leon van Wyk. I'm a member of this committee.
Good morning, Chair. So up to you, Memory.
Good morning, Chairperson, Minister, colleagues and officials. Special good morning, and I greet the ladies with the long nails as well. Morning.
After such an effusive greeting, morning everyone. I'm Benedicta Perminnen and I'm a member of this committee, and I don't have long nails.
Good morning, Chair and everyone. My name is Rachel Winvogel and I'm an alternative member of this committee.
Any other members online? Not? Then we will move over to the introduction. I'm giving an opportunity to Minister. Please introduce yourself and your team as well as the HOD, please. You may proceed.
Thank you. Good morning, Chairperson, and to the committee members and also to the team from DSD. My name is Jacques Lund and Minister of Social Development here in the Western Cape. And then HOD, I'm going to hand over.
Excuse me, my apologies, Honourable Minister, members. Member Stevens. Can I please ask that ICT assist me in this regard, just for us to maintain order during this meeting? Thank you very much. Please mute yourselves, members. You may proceed, Minister. My apologies.
No worries. Thank you so much. And then HOD, over to you and your team. Thank you.
Good morning, Honourable Chairperson, Honourable Members, Minister, as well as colleagues. I'm Robert McDonald, Head of Social Development in the Western Cape, and I'm joined by my management team. So I'll ask them to introduce themselves one by one. Thanks.
Thank you, Dr. McDonald.
Good morning, Honourable Chair. I'm Zwandile Ewu, the Chief Director for Community and Partnership Development within the Department of Social Development. Good morning, everybody.
Good morning, Chair. I'm Din Bahali, Acting CFO for the Department of Social Development.
Good morning, Chairperson. Good morning, members. My name is Gavin Miller. I'm the Director for Research and Information Management.
Good morning, Chair, members. Leona Goosen, Chief Director, Social Welfare and Restorative Services.
Good morning, Chair. Good morning, members and colleagues. Abdul Raycliffe, Department of Social Development, Director, Restorative Services. Thank you.
Good morning, Chair. Good morning, members. I am Mashinette Jonkerman, Director, Facility Management. Good morning, all.
Good morning, Chair. Good morning, Minister, HOD. My name is Petrona van Wyk and I'm the Acting Director, Operational Management Support in HOD's office.
Good morning, Chair and members. Charles Jordan, Chief Director, Children, Families and Vulnerable Groups. Thank you.
Good morning, Chair and members. Annemie van Reenen, responsible for the regions.
Thank you very much. Dr. McDonald, is that team?
Yes, Chair, we've got one or two
You haven't
others.
missed anyone?
Apologies. Good morning, Chair. Monique Motlak-Malgas, MLO to Minister Lund.
Good morning, Chair. Bernard Lodgett, HAM to MEC Yakulont.
Then we've got Ms. Abercrombie.
Morning, Chair and members. Janine Abercrombie, Office of the CFO.
Thank you very much. Is that the team?
Yeah, I think we've got everyone now. Thank you, Chairperson.
Thank you very much, Dr. McDonald. And then Ms. Jamke, any apologies?
Morning, Chair. Morning,
Good morning.
members. No apologies. Thank you.
Thank you so much, Ms. Jamke. Honorable members and Minister and
Chairperson?
Yes, is that Member Van Poegel?
My apologies. Yes, Chair. My apologies for interrupting you, Chair. My hand was up. Member Comfort is struggling to log in, but he will join at a later stage as they solve these problems. Thank you, Chair.
Sure. Thank you very much, Member Van Poegel, for alluding to that. And I'm happy that ICT is assisting Member Comfort. Honorable members, we will be moving along with the agenda because we want to give you ample time, sufficient time to deal with the various sections of the budget and also allow for sufficient time for responses as well. So this meeting, as I've mentioned in the beginning, is to deliberate on vote 7, social development, in the schedule to the Western Cape Appropriation Bill B2 of 2025. Now, honourable members, bearing in mind that the Western Cape Department of Social Development is committed to provide essential social welfare services to the most vulnerable citizens in society, and through their strategic partnerships with stakeholders and civil society, they should ensure that those in need receive the necessary support. And at the same time, community development initiatives should focus on the sustainable programs to empower individuals and uplift entire communities and fostering those resilience and self-reliance. Now, I'm sure when the Honourable Minister Bartman tabled the budget, there was already quite a few questions, and today we have the opportunity to specifically zoom into vote 7 and dissect ultimately, and for you then to raise your questions as well. Honourable members, I am going to indicate just a bit later on after Minister and HOD do their opening remarks in terms of how we're gonna dissect budget vote 7 in terms of the various sections, so that we don't go back and forth in between pages, but when we then are on a certain section, we will then deal with that specific section. So I will ask you if you have any further questions, any further follow-up, so that we know once we've concluded a certain section in the budget vote, then we have dealt with that section. At this point, Minister Lund, I'm going to hand over to you to give us a brief overview and remarks on the budget of the Department of Social Development. And then after you, the HOD, Dr. McDonald, you are more than welcome to also give your brief overview if you do have anything to add to what the Minister said. Thank you very much. Over to you, Minister.
Thank you, Chairperson. This is my first full budget process with the committee, so I'm quite excited that we got to this point now. And also want to say a big shout out to all the staff that have worked really hard over the last few weeks and months to get us to this point. Also to the committee yourself for keeping us on our toes. I do think that we have been working well together. We've been held to account, and I want to say thank you for that. We're also in a very unique circumstances in the history of South Africa that we have not yet passed the national budget, and so it's some aspects might still be up in the air. But what we have in front of us and in front of the committee is encouraging for the Department of Social Development. And for that, I want to say thank you for those that have been putting the work that the department does out there. If you sell what you do, even if you don't get a lot, you tend to get more. And you would have also heard that during the budget delivered by Minister Bartman last week, that Department of Social Development was mentioned quite a few times. So, Chairperson, I'm not going to go through everything now. We will be going through that as we progress through the budget, but you can see that we have got some increases, of which we are incredibly thankful. There is additional funding for cost of living adjustments for employees. There is the additional funding for the SWIMS app. There is additional money for safety measures for our DSD staff and facilities. The nutritional and health services at Sibuyile, there's additional funding for that. Very encouraging, there's an increase in subsidies for frail older persons in old age homes. I know it's something that has been close to the heart of many of the committee members. There's to support additional funding for support people in homes with disabilities. To humanitarian relief organizations, there's extra funding as well. Child and youth care services, child protection organizations, they're all getting additional funding. Crime prevention, additional for municipal services, maintenance and repairs, victim empowerment services, substance abuse services, and then also a new gender-based violence center, extra for Tutuzela Care Center, and then also community nutritional and development centers. But that will all be broken down throughout the engagements. But all of this is not possible without the incredible work from the officials that sell the many or the amount of work that they do with not a lot of funding, and also for yourself and the committee that highlights it and flags issues that there might be amongst the vulnerable in this province, that also allows us to put our arguments forward. So that's by way of introductory remarks, Chair. From my side, I'm happy that we can get stuck into the meat of it.
Thank you very much, Minister Lon. Anything to add, Dr. McDonald?
Thank you very much, Honourable Chair, and thank you to the Minister for those words of encouragement. And also, I think the Minister has covered most of it. Essentially, the budget that we have in front of us, if we are fortunate enough to see it come to pass in its proposed form, does contemplate significant increases, as the Minister has said, and it does help us, particularly in the space of the NGOs, which have been under a lot of pressure. But of course, we still are waiting with bated breath for the finalisation of the budget nationally. I think just to say, at the moment we are operating on the 2024-25 budget in this year, as per the rules of the Public Finance Management Act. So this budget isn't yet implemented; it can't be implemented yet. So we are spending based on the previous year's budget still in this financial year. That will continue until we are able to pass this budget. So we are hoping that that process will be resolved soon, because that will then enable us to, for example, increase our allocations to the NGOs to help them with inflation, as well as where they are really struggling, like in the older person sectors and others, as the Minister has mentioned. So yeah, that's just maybe one additional point. But other than that, I think all the key issues are contained in the document, so I won't prolong the introduction. Thank you, Chair.
Thank you very much, Dr. McDonald. Both the introductory remarks of Mr. Lund and the HOD are then duly noted and recorded as such. Honourable members, for us to get into the meat of today, I will table the budget page by page, but in the various sections, as I have alluded to at the beginning of the meeting. I will then allow committee members to pose questions on those sections that we are dealing with. The budget vote social development starts on page 297 of the Blue Book. I see Ms. Junke has also provided us with an extract of the book, and it ends on page 325. Honourable members, please note that pages 326 to 339 are annexures, but members are also allowed to pose questions, if any, on that specific section. So, honourable members, to make it easy for us to control and to make sure that your questions are addressed, ons gaan hierdie olifant vanoggend so stukkie by stukkie eet. So starting from pages, or rather page 297, if you can please make a note on your side, pages 297 to 304. 297 to 304, and that pages deals with the overview, the mission, the core functions and the responsibilities. It starts also the main services per line function. Page 298 speaks to the support functions and gives a brief analysis of demand for and expected changes in services, and that continues on page 299 as well as on page 300. Honourable members, our section that we are dealing with also includes page 301. That deals with the acts, the rules and the regulations. It deals with the budget decisions, aligning departmental budgets to achieve government prescribed outcomes. And that part continues to page 302. And then also on page 302 deals with a review of the financial year 2024-25, and that continues on page 303. Honourable members, on page 303, there is the outlook for the financial year 2025-2026, and that continues to page 304. And on page 304 as well, speaks to the service delivery risk, and it also speaks to reprioritization. Honourable members, we are there now dealing pages 297 to pages 304. You are now most welcome to pose your questions on that section, honourable members. I recognize the Honourable Van Minen. You may proceed, member.
Thank you very much. I just want to ask a question on service delivery risks on page 304. It says there on the third line under service delivery risks that stagnant or reduced levels of funding to NPOs will likely result in closure of many of these organizations. My question is, I mean, we've dealt with this with health and wellness. Is it foreseen that there will be a reduction in funding due to the United States limit or cutting funding entirely to a lot of programs in Africa? Is that what this refers to there? And if so, has the department got plans to pick up the slack is probably the best way I could put it. Thank you.
Thank you very much, Member Van Minen. And then I recognize Member Windvogel.
Thank you, Chair. Chair, my question is on page 203, paragraph 5.
My apologies, Member Windvogel. Just that page number again, please.
302. 302.
Thank you.
Yes. I just wanted to find out from the department, In respect of the establishment of the cabinet level committee on food security and nutrition that was announced by the Premier in his SOPA speech, what is the scope of work of the committee, and what updates can the department perhaps provide on its functions, and how much is allocated in this budget to support its work? Then, Chair, my second question will be on 303, the outlook for the upcoming financial year. I just also, the President of the Republic of South Africa, in his speech, said that the country will soon adopt a national strategy to accelerate action for children. In anticipation of this, how much has been allocated in this budget for this purpose? Does the department have data on the number of child-headed households in the province as well, as children who are not going to ECD centers? Thank you, Chair.
Thank you very much, Member Windvogel. And then I recognize Member Kamfer. Good morning and welcome, Member. Happy that you could join us.
Morning, Chairperson, colleagues, administration, professionals. Thank you, Chair. My question is in page 297, our head function of onze hooffunctie van die departement. I'm very glad to see what is the priority of the department, and I agree with the core function of the department. But my concern is, Chair, if I look at the core function and I see the resultaten, Chair, I'm a bit concerned. So my question is very short, Chair, and I will come to my mother language in Afrikaans, Chair, om die volgende twee vrae te vra, Chair. Ek sien die MEC, die minister noem in haar budget speech rede, noem sy ons voedselslyn in die provinsie is 40,3%. Sê dit bring my by die volgende vraag. Indien dit 40% is wat vir my baie hoog is, watter programme het die departement in plek om hierdie krisis aan te spreek? Die volgende vraag aan die departement is, hoe word hierdie begroting dan, is daar begroot om hierdie krisis aan te spreek? My derde vraag is, is in die provinsie, word daar net slegs vir in die CITC inisiatief aangespreek, of hoe word dit wel gedoen, Chair? Baie dankie, Chairperson and colleagues.
Baie dankie, Lid Kamfer. And then I recognize Member Stevens.
Thank you, Chair. Sorry for all the trouble this morning. My speaker didn't want to work on my laptop, so I had to change to my phone. Yes, I just want to ask on page 304, also on service deliveries, Member Van Minnen. I know there was a lot of job lost. Like Anova was one of the NPOs that worked at the day hospitals. So their staff was told yesterday that the contract ended. And they did bring in a new NPO caring network. So they coming with their own staff. Wasn't it that the rule that if another NPO takes over, they must at least take the staff that's at the moment working at the facilities? Because now they're saying that they're going to let the people know it in a week's time. So all the patients that those carers were taking care of must now sit without caring for a whole week until this new NPO sort out the problems between Anova and caring network. So it's not right for me towards the carers that was working at the moment for Anova in this different facilities and the patients that must now sit without caring for a whole week until between caring network and Anova, they sort out their problems. It's not right towards the patients and to the carers that's now going to sit without jobs and they bringing in new carers for the different facilities. Thank you, Chair.
Thank you very much, Member Stevens. And you almost never give trouble to this committee, so you are excused this morning. Honourable Minister, I think the issue of food insecurity. I see there's an 18.1% challenge in the province itself. I'm not going to rehash. Members has alluded to that. So I'm also looking forward in terms of the department's response accordingly. Can I also just ask for us to perhaps just follow the following order as well in terms of responses? As members pose their questions, can we just receive the response in that order as well? Because we're not in person, it sometimes makes it a bit difficult for members to follow up on their response. You would find a specific question being answered and then a member would revert back and say, but my question was not answered. So if we can perhaps also maintain the order in which the questions was asked, to also respond in that order, please. And after the department or minister have then responded back, I will open up to members again for any follow-up questions based on the response received. I hope that's in order, members. I will then now give over to Minister, and Minister, you can then indicate to Dr. McDonald, and Dr. McDonald can further indicate which of the officials will then specifically respond to certain questions. Thank you very much.
Thank you. So, Chairperson, we have touched, I'll make a few introductory remarks and then the HOD can take it from there. We have touched on it in the past that it is definitely not an ideal situation where we do not get our fair share of the budget. And it's something that we are continuously fighting. Our province's population has increased significantly. And if you look at what share we are getting from the national budget in the province, it already puts us on the back foot. In the province itself, we, for instance, social workers does not get classified as essential services by the national government. So we do not get the necessary funding for that. But in the province, we do view them that they are essential workers. And that then puts pressure. If we have to adhere to our statutory obligations, that put pressure on the funding that's available to our partner organizations, NGOs. And that is why we hope that situation will change, but you can't just plan on hope. You need to plan on what's the reality. And that is why we have then gone the route of signing the MOA for the Cape Care Fund, and we'll have the launch later in this year then to try and then mitigate the risk that there is for NPOs like the member referred to. And correctly so, Minister Wenger heads up the food security portfolio. Members that serve on that knows what gets done in that portfolio. And also maybe the HOD or Mr. Heu can speak to the exact numbers of what we are spending in that. But of course, the need is great in the province, and that's also why we will continuously to try and find extra resources. But with what's available in front of us, we have expanded that footprint in our community nutrition program. But HOD, if you can maybe go to the specific details, and then Chair, if we've missed anything, you're welcome to flag, but I take note also that we'll, going forward, make sure we all answer them in order that they were asked. Thanks.
Sure. Thank you very much, Minister. Dr. McDonald.
Thank you very much, Honourable Chair. So I think starting from the first question from Honourable Member Van Minnen, the USAID funds being suspended and probably permanently withdrawn has had a marginal effect on social development when compared with the impact on the Department of Health, where they've got a very large sum of money that they were receiving from the Department of Social Development. USAID was funding approximately 12 million in the past financial year. We hadn't yet received a fixed allocation for the new financial year when the money was frozen. So the project that USAID had initiated with that funding was a specific partnership with social development to assist children who are victims of sexual violence and children who are at risk of HIV infection. And it involved a lot of work with children at risk and their parents and families. So it was a project that didn't involve any medications or anything like that. It was to assist with more reducing the risk to these children. And it was involving NGOs as well as our own staff doing certain activities. So we've been able to continue with those activities internally, but the funds that the NGOs were receiving, those have been stopped. So it will impact the NGOs that were involved, and that is something that we are looking at how we can mitigate that. But it's fortunately it's not a massive sum of funds compared to the other cuts that have happened in other departments. I think the concern for us has been firstly that some of the NGOs we fund and that do services in the social development space have also been impacted by the cuts because they've been receiving funds either directly from agencies like USAID and PEPFAR, but also through the government-to-government funds in other sectors like health. So there's a risk to the finances of some of the NGOs we work with, particularly in the GBV space. And we are monitoring that closely because we don't want to see NGOs closing that we are also working with, because obviously that will affect the services to the citizens that were being rendered. The other thing is that these cuts come at a time when we really need the donor community out there in the corporate sector, private citizens, international donors. We really are hoping to see that funding come into the social development space. So it has left a hole in the space for donors, and we are now in the situation where I think it means that it's going to get harder for all of the NGOs because there's less money to go around overall. So I think that's the biggest concern is the net impact on the NGO sector, which is so important to us as a department, given that they act as a force multiplier for social development. The plans essentially, I mean, we've been, as I say, we're looking at how we can take up the space in the social development funding so that we don't lose services that have been initiated. That is something that we should be able to mitigate quite effectively. I think the bigger picture of donor or the strain on donors is going to be a little bit more difficult. We are trying to work with the Cape Care Fund to get that set up to increase donations into the social development sector. So it may mean that we get off to a slower start than we'd hoped to, but things will begin to normalize, we think, within the next few years, because there are other donors already starting to talk about coming into this space. So I think it is a difficult and unfortunate situation, and it's going to require quite a lot of adjustment for the NGO sector in particular. The question from Honourable Member Windvogel. I think MEC mentioned that there has been a Cabinet Food Security Committee established, and the work is underway to really fine-tune what all of the different members are doing in that space. But there have been some initial allocations in social development to assist us with increasing our food security contribution as part of that committee. In particular, we have now got some additional funds for emergency food relief in disasters, where it was particularly in things like floods and fires. We are now funding organizations that can move quickly to assist as first responders when there is a disaster and food is required. That is something that we are trying for the first time. There have been some funds already transferred in this financial year, around 8 million, and then there is some additional funds in this budget that have been put aside. I'll also ask Mr. Hewu to give a little bit more detail about what's allocated this year for both this purpose and also for food security in general, including the community nutrition and development centres and community kitchens. So I'll just ask Mr. Hewu to give you a bit more detail on those numbers. Thanks.
Thank you very much, HOD. Through you, Chairperson. This year, our total budget will be about 45 million for food, and with that we have received an additional 1.8 million to sustain our feeding in community nutrition and development centers. As the Minister and HOD indicated, there's a challenge of hunger and food insecurity in many communities. No single department can deal with that challenge. We need collaboration, we need partnerships and working together with the other organizations, other government departments to put our resources together so that we can maximize the impact. DSD intervention remains in 3 focus areas. One is our community nutrition and development centers, where we support 102 feeding sites province-wide. And we also support community-based organizations that are in the food relief space, so that we can at least extend the reach of government, particularly of the Department of Social Development. And also we provide emergency food relief through food parcels when we receive requests from various communities, situations that will be assessed by social workers to determine the vulnerability of that family or household, and then a food parcel or 2 food parcels, depending on the size of the family, then it gets issued. So that is what we are doing as a contribution of DSD to deal with hunger and food insecurity in communities. The 8 million that HOD referred to is targeting at post-disaster humanitarian support, which might be hot meals, where SASSA is not able to respond faster. It will also be in the form of food parcels where beneficiaries affected are not able to cook, are able to cook for themselves, and then food parcels will then be distributed. Otherwise, the rest of it is to respond to whatever form of post-disaster humanitarian relief or support that might be required, be it blankets, be it mattresses, be it sanitary dignity bags, be it vanity bags, be it baby food, and so on, be it bottled water, whatever intervention that will be required at that stage. So that's what I will say at this stage, HOD. Thank you very much, Chair.
Thank you, Mr. Hewu.
Thank you very much. I just want to determine, Member Stevens, your question has been addressed.
Yes, Chair, thank you.
Sure, you're satisfied. Thank you very much. May I ask, Mr. Hewu, we hear about these relief interventions and that they are available. If someone from the community is currently, or any stakeholder organization, are listening to the committee this morning, what are the proper procedure for them to apply for these packages or funding ultimately to the department? What are the process? If you can please just enlighten the committee as well, please.
Thank you very much, Chairperson. What we do, Honorable Chairperson, in most communities, we've got the social development local office, service delivery areas in the rural municipal spaces. We encourage any individual who is facing food insecurity to approach the local DSD office and indicate his or her situation. The local office will dispatch social workers to visit that family to assess the socio-economic situation of that family, write a report, and then request a food parcel to be delivered to that for that family. This is what is happening at the moment, Honorable Chair. Other NGOs, priests and pastors in communities, they usually identify households that are vulnerable, and then they will write a referral to our community nutrition and development centers to say there is this family that is without food, they are not able to have food to cook for themselves, and then we wish to consider if they cannot be included in the community nutrition and development center to receive the cooked meals, which we provide from Monday to Friday every day. So that gets put into the database of that community nutrition and development center, and that family then receives the food from the CNDC for the whole week until the situation of that member changes by probably getting a job or receive other support from other sources. I'm not sure if that is adequate, Chair. Thank you very much.
Thank you very much, Mr. Hewu. That certainly does assist in understanding what the procedure is for assistance. Can I just ask, I see your hand, Member Kamfer. I will attend to you shortly. You mentioned Monday to Friday. What happens over weekends?
Honorable, that is the biggest problem that we have, and it's a budget issue. There are other CNDCs that received food from other sources, Food Forward, Gift of the Givers. Those are able to feed Saturday and Sunday. There's one, for instance, that we are supporting in Guguletu. I will invite members, the NY3, to go there and see, through the support from other sources, they are able to feed large numbers of beneficiaries Saturday and Sunday. So it's a budget issue, Honorable Chair. Our budget can only feed or support CNDCs from Monday to Friday. Thanks.
Thank you very much, Mr. Hewu. Member Kamfer, is that a follow-up question?
No, Chair, maybe ek het verkeerd gehoor of ek het sleg gehoor of I can't hear. What my question, I get no answer on the second question. What program the department in place for the crisis? Maybe that was answered, was lower. I can't hear it. That is all, Chair. Thank you.
Dankie, lid Kamfer. Ek dink die departement het breedvoerig 'n bietjie uitgebrei oor wat dit is. Maar there's no harm in asking the department to just, for your sake, maybe there was a bit of a connection issue, just to repeat the response. I'm sure there's no harm in that. Dr. McDonald or Mr. Hewu?
Thanks, Chair. We hadn't got through all the questions yet, so I think maybe we haven't reached Honourable Member Kamfer's question yet, but we will get to that. Once I think we're still busy with Honourable Member Van Vogel's first question. I think also just to say the department is trying to have a kind of range of options for people. So there is the community nutrition development centers and the community kitchens for people who can get to those. But the food parcels are really something we keep for people who can't get to to one of the community nutrition centers. It's also for people who are otherwise unable to support themselves through the usual channels, like with SASA. So we work to kind of fill in the gaps in a sense. We don't work in isolation. There is SASSA providing grants, and of course they still have the COVID grant as well. And then social development is just working in the gaps where the people fall through those safety nets. And particularly in the rural areas where people can't get to shops or they can't get to a feeding scheme because of distance issues, that's where we might use food parcels. So we're not distributing a lot of food parcels. It's only really reserved for when we have people who can't get food from any other means, and they need an emergency form of assistance. I think also to say that, of course, we are working together with the interministerial committee, the cabinet committee that has been set up, because each department in that committee has its role. The education department has a very big spread with the school feeding schemes, and then the Department of Health has also got an important role to play with infant nutrition, and of course they pick up all the malnutrition cases and the stunting cases. So we work together with other departments, and then also SASSA, which is the main provider of social safety from an economic perspective. So I think it's just important to see how we fit in. And we're quite a small player, but we have a niche and a quite important role. And of course, our social workers are also doing the assessments and referrals to SASSA as well, because we work with SASSA. Where we pick up cases that people need assistance from SASSA, then we do assessments and we refer them to SASSA. So, Chair, if I may move to the second question from Honourable Windvogel.
Just before you move on, Dr. McDonald, thank you very much. My assumption was that when Mr. Haywell extended on the issue, that we're concluding with that. So you were quite right, Member Kamfer, and thank you so much for alluding to that. You may continue. Thank you, Dr. McDonald.
Thank you very much, Honourable Chair. The second question from Honourable Member Windvogel was around the presidential strategy for early childhood development, and whether we have data on child-headed households, children not in ECD, and what our allocations are in that space. I think it's perhaps early days for that presidential strategy, but the ECD function has moved to the education department, and they did take over all of social development's data and info on that, but we did have estimates around children not in ECD, and I think they are continuing to monitor that. The ECD coverage in the province it's a mixture, because we have children in formal ECD. We have children in ECDs that are funded by the state, which is the Department of Education, and then there is also a non-center based ECD. So it's quite a tricky bit of data to pin down, because we have information on children who are in state-funded ECD, but it's more difficult to get information about children who are in non-center-based ECD. But that data is available, and I think we probably have it. We can provide it if the committee would like to request it. Data on child-headed households, we also do have that, and we can provide that to the committee on request. And of course, child protection is one of our core mandates. So there is significant funding for child protection across different programs in the department, including the Child Care and Protection Program itself, and then also the child and youth care centres, and in a number of other areas too. So yes, we do have. I think if you did an analysis of social development's budget, a significant proportion does go towards children, but we will also see what comes with the national strategy for children and how that might call on the social development sector to add anything or adjust anything. I think in the end, social development is the lead department for child safety, together with health, which is critical for particularly infant and childhood well-being. So I think we can, if there's a desire to see a breakdown of exactly how much goes to children in social development, we can provide that. But it would require us just to go through the different programs and look at where it comes to. For Honourable Member Comfort's question, one thing I didn't pick up was what when you referred to what programs we have in place to address the crisis. I wasn't 100% sure I understood what the question was in terms of the crisis that Honourable Member identified. Maybe you could just clarify that for me. I think I'm not sure if I heard it correctly.
Sure, Dr. McDonald. Member Comfort. As u net meer duidelikheid kan gee op daardie vraag asseblief.
Yes, Chair. I refer to the Honourable Minister referred that it is 40.3 percentage that the food crisis in the province. And now my question was, is the budget for that 40? How will the department ensure that they serve that 14.3 percentage? That is the question. Thank you, Chair.
Thank you very much, Member Comfort. Dr. McDonald.
So, sorry, where would the 40.3% was that referred to in the minister's statement? Maybe I'll ask the minister just to speak to that quickly, because I wasn't sure if I understand that. Sorry.
Sure. Thanks, Dr. McDonald. Or rather, Member Comfort. Can you please mute yourself, Member Van Vogel? Thank you. Member Comfort, is that on pages 297 to 304, or is it a remark made by the minister?
Yes. The minister revealed that verwys dat die percentage is 40.3% in die provinsie. Nou die vraag wat ek vraag is ons gereed om die 40.3% te serve? Wat het ons in plek om dit aan te spreek? Is dit deel van die budget? Hoe gaan ons dit aanspreek? Het ons 'n program vir dit? Die departement.
Baie dankie, lid Kamfer. Minister Lon.
Agbare voorsitter, ek dit onthou nie dat ek na 40.3% verwys het nie. Ek kan nou vinnig probeer dink. Ek bedoel, een van die goeders wat in die 40.000 is waarna ek verwys sal wees 43.000 kinders wat in ons foster system is. As ons 'n ander ding wat in die 40% is gewoonlik ons oordrag na nie-regeringsorganisasies. So ek probeer nou alles dink wat in die 40% kon wees. As ons praat van huishoudings wat sukkel met voedsel, dit dink ek het u self na verwys is nou onder 20%, maar ek kan nie 'n 40.3% herroep waarna ek verwys het nie, voorsitter.
Dankie, minister. Lid Kamfer, sal u dan nou verwys na die 18.1%?
Chair?
Het so oomblik, lid Witvogel? Chairperson, ek gaan net gou terug, ek lees dit gou weer, ek het dit 40.3% te gelees, maar ek gaan net gou seker maak in Honourable Minister Baartman se begrotingsrede.
Dis reg, lid Kamfer, ek gaan vir geleentheid gee om nie terug te gaan na u verwysing. En intussen, I recognize Member Van Vogel.
Nou, net om aan te heg, Chair, by miskien om meer clarity te gee op Member Kamfer se vraag. Ek dink hy het klaar clarity gegee, dit was nie die Minister van Social Development nie, maar wel die MEC Baartman in haar speech het sy verwys na die poverty line in the province wat 40.3% is. So ek dink dis waarna Member Kamfer verwys, Chairperson. En hy wil weet is die ja, so dit is die vraag is based on that line, Chair, of MEC Bartman. Thanks, Chair.
Noted. Thank you very much, Member Windvogel. Member Kamfer, can you confirm?
100%, Chair. That is what I mentioned now in Honorable Bartman's speech, in the budget speech.
Minister of Finance's speech. Thank you very much, Member Kamfer. Minister Lund or Dr. McDonald?
Thank you very much, Chair. Apologies. I think, yeah, we just now that clarifies. I do understand now. Thank you very much for that. I think the Department of Social Development, a lot of our services are geared towards mitigating the impact of the high level of poverty and unemployment that we are sitting with in the province. If you look at a lot of our programs, they are safety net programs, but also there are empowerment programs, developmental programs to try and help individuals to find their way out of poverty and to start to get jobs and opportunities. So we have our youth development program, which includes assisting young people to adapt to being in the career world through assisting them with job interview skills, CV writing skills, development of life skills, so that they're able to orient themselves and work with in an organized environment. So equipping them with the soft skills that they need to operate in the work environment. We also have the BWP programs, and as Mr. Hewitt mentioned earlier, there are also in our community nutrition and development centers, we have programs where we try to help the people to become more self-reliant. There's a lot of other programs as well in each of our priority areas. If you in disabilities, we have protective workshops where we help people learn crafts and other things that they can begin to get a little bit of an income. In our child and youth care centers, we offer education so that the children who have been placed in secure care can complete their matric. So there's a range of programs in social development that are geared towards helping people to become self-sufficient and get on their own feet. I think the reality is social development is quite a small player compared to a big department like education, but we are targeting of the most vulnerable. So it's a very specific group that we work with, and we partner with departments like education, and economic development, and so forth to try and get opportunities for the vulnerable people. We work with linking our beneficiaries who are in our caseloads to opportunities wherever we can for things like internships, apprenticeships, and so on. So, I mean, the key issue, the key to addressing the crisis of unemployment in the province and the high poverty levels, I think, as Minister Bartman had mentioned, is that we need sustained economic growth. And so the economy is key to reducing this poverty and the inequality in the province. And I think that social development has a role in that space that we play. And we also do see that as a department, that high level of poverty puts a lot of pressure on our system. So we see it as a very high priority to bring down that level of poverty. And I think that the social development services do also assist with creating a greater safety net for children so that they can grow up and instead of being in a state of abuse, danger, and uncertainty and trauma, we can help children grow to become productive adults who can actually finish their education, develop skills, and enter the economy. So I think social development has a role to play in all of that, and that's why we have the transversal priorities, including the safety priority in the province and the jobs priority, where we have a role in all of those things together with all of the other departments, because we can't do it alone. So I think, Chair, hopefully that that does cover Honourable Member Comfort's question. If you look at the budget side of things, I think in this question, we do have budget allocations across all of the programs that speak to the issue of poverty, whether it's alleviating poverty or whether it's trying to turn the needle back and reduce the levels of poverty. The question from Honourable Member Stevens about the caring network taking over from the Innova network, I think that would be in the health sector, not in social development. So we can't really speak to that. I think that question would have to go to the Department of Health. But there is no fundamental requirement that if one NGO takes over from another, that they take the staff over. It can be something that the two organizations agree on, but it's not. There's not an actual requirement as I understand it. But I think the issue of that transfer of service would have to be taken up with health, because hospitals don't fall within social development. Thank you, Chair.
Thank you very much, Dr. McDonald. Honourable members, are there any follow-up questions in this round? I do not see. Member Van Vogel, you may proceed, member.
Thank you, Chair. Chair, mine is on page 304. It was touched by Member Van Minnen and Member Stevens. I just wanted to check with the department what is the number of MPOs that might find themselves in this challenge and may be forced to close down. Do they have the number of those MPOs? Thank you, Chair. It's just a follow-up on that.
Thank you very much, Member Van Vogel. Minister Dr. McDonald.
Thank you, Chair. I assume this is with reference to the USAID funding cuts.
Yes.
I think Mr. Jordan can assist with the organisations that are directly affected, which were receiving funds, and then the ones that are indirectly funded or indirectly affected, should I say, is we know in our space there is about 5 organizations that are indirectly affected in the sense that we weren't funding them with USAID funds ourselves, but we are funding them and they are now affected by the USAID cuts that they were receiving from elsewhere. Yeah, there's about 5 that we fund that had cuts because of USAID. That was not through us, but Mr. Jordan will tell you the number that we were funding with USAID funding that have now stopped receiving funds. Thanks, Mr. Jordan.
Thank you very much, Dr. McDonald. Mr. Jordan.
Thank you, HUD. Thank you, Chair. Yes, for this USAID project, it's a total of $5 million. That was the full project. There is 5 NGOs being affected. So 4 of them are drop-in centers, and 1 is an NGO that was providing support to our regional offices that's involved with this project. So the 4 drop-in centers, they will lose that money from the USAID, but it will not affect them closing down because they do get other funds from DST for their operations and for rendering services. So it's just that they got additional bit of extra money to help with the project. So that 4 drop-in centers will not close down. The other remaining NGOs specifically, they were exclusively helping with the USAID project. It's 8 staff members. So that contract is valid till the end of October. So by the end of October of this year, that USAID money for that 8 staff will no longer be available. I have talked to the director of that specific NGO. They, however, will also not close down because we are not the only project that they are managing. They've got 3 other projects that they get international donor funding from and national funding, so they will also not close down. But the 8 staff that work specifically with this project, they are at risk of losing their jobs. I'm not sure about Ms. Goosen. I think Ms. Goosen, our other chief director with the TCCs, there was some pay for funding. Ms. Goosen, I don't know how to fix your NGOs. Thanks.
Thank you very
Yes,
much,
thank you.
Mr. Jordan. Ms. Goosen.
Yes, thank you, Chair. Some of our TCCs are affected, especially with the health-related services linked to it. So, except for one where we will increase our funding to at least cover the fact that a 24/7 service still can continue to be rendered. The other services that are affected are those of Department of Health, and they will step in terms of that services. We will continue with our funding as usual.
Thank you very
Thank
much,
you.
Ms. Goosen.
Chair, yeah,
Dr. McDonald?
so just to clarify, TCCs are the Tutuzela Care
Yeah.
Centres, where we fund organisations to provide psychosocial support for victims of GBV, particularly rape. Chair, just to say that that $5 million that we had allocated or committed from USAID was for a 5-year period. So we've so far, I think, had 2 years of that 5-year period that have been funded, but the funding was cut during the course of the second year. So yeah, thanks, Chair.
Thank you very much, Dr. McDonald. Members, any other follow-up questions? Let me then ask any new questions on pages 297 to 304. No hands. Thank you very much, members. We will then now move to pages 305 to 309. And on page 305, members, it states points 6 and 7 that deals with procurement and receipts and financing. Page 306 deals with a summary of receipts, treasury funding, departmental receipts, and also on page 306 is point 8, which deals with a payment summary. On page 307, it is the national and provincial priorities per program. There's also the program summary and table 8.1, which is the summary of payments and estimates. On page 308, it is the earmarked allocation, the summary by economic classification. Also on the page is table 8.2, which deals with the summary of payments and estimates by economic classification. It also deals with the infrastructure payments, departmental public-private partnership projects, as well as transfers to public entities. Honourable members, also on page 309, that deals with the transfer to other entities. Also on that page is table 8.3, the summary of departmental transfers to other entities, and also another table 8.4 is transfers to local government. So pages 305 to 309. Members are now welcome to ask questions on that specific pages. Please do indicate your page number as well. Members, also bear in mind that if you require any other information, we will have to have, after adopting our report, the opportunity to engage with resolutions and recommendations accordingly to ask for further information as well. So, honourable members, you may now address your questions pertaining to those pages. Now, questions on pages 305 to 309, members. I see Member Van Vogel.
Thank you, Chairperson. Chair, my question then on page 313.
Member Van Vogel, I'm still at page 305 to 309. So I'm just determining finally whether there's no questions on those pages.
Okay, noted, Chair.
I will come back to you. Thank you, member. So there's no questions on that pages. Members, then we move over to pages 310 to 323.9, which deals with the program description. On page 310, program 1, administration. Page 312 specifies program 2, which is social welfare services. Page 315 deals with program 3, which is children and families. Page 317 deals with program 4, and that is restorative services. Page 320 deals with program 5, which is development and research. And page 323 deals with the end of the sections, and that ends with the details of transfers and subsidies. So any questions from pages 310 to 323, members are now welcome to pose them. I recognize Member Van Vogel.
Thank you, Chairperson. So yeah, my question is on page 313. Allegations of abuse of older persons are investigated. Chair, in respect of the 2024 research report by Inkamba Labantu on elder abuse in Cape Town Township, which found women are abused more frequently and experience a wider range of abuse. So I want to understand what work is the department doing to ensure protection of elderly people in their homes and communities, and did the MEC conclude this investigation into allegations of abuse of elderly persons against Baconville Frail Care Center? And if so, what were the findings and recommendations? Then secondly, Chair, on page 319, substance abuse, table 9.4, what is the update in respect of the drug master plan? Which municipalities are lagging behind in establishing local action drug committees? Then lastly, Chair, page 322, table 9.5. I want to understand, why is the budget for poverty alleviation and sustainable livelihood decreased? This is really sad, especially in the face of rising poverty and cost of living. I will park there. Thanks, Chair.
Thank you very much, Member Van Vogel. Any other member? I don't see any further hands, and then I will give over to Minister Lund and Dr. McDonald. Please direct the questions accordingly or respond. Thank you.
Yeah, it's always good to have that sense of humor. So I also sometimes refer to it as Baconville now, but it is Beaconville. And as I explained in the House when there was oral questions around this, there's been a turnaround plan put in place. So I think after Dr. McDonald has spoken to some of the other questions, maybe Chief Director Jordan can just say on what the latest was on the regular monitoring that we have committed in the House to be doing, so that we can then all be on the same page. Thank you.
Thank you very much, Minister.
Thank you very much, Chairperson and Minister. I think Mr. Jordan can also speak to what DSD does to protect older persons, what role we have, and then maybe you can just give an update on Beaconville. Thanks, Mr. Jordan.
Thank you very much, Dr. McDonald. Mr. Jordan.
Thank you, Chairperson. Yes, when it comes to older abuse, it is quite a very, very concerning matter in not only the Western Cape Province, but South Africa. But let us then rather concentrate on the Western Cape Province. As we've all seen with the amendment of the Older Persons Bill, there is specific functions that's been placed in the amendment of the Older Persons Bill to deal with elder abuse. To actually support that function, so we've got various NGOs specifically involved with awareness raising. We've got also Age in Action that support us specifically with abuse cases that we deal with and investigate. I think the positive thing that I've picked up this past year is that the courts are coming to the party with regards to the Older Persons Act. In the past, the courts, where there was a case of abuse, they would not have easily prosecuted the person, not even using the Older Persons Act as a reference with the specific regulations on abuse. So I think there was a few cases that you are aware of as members. For example, the one case was the grandson that abused his grandmother in the house, and immediately the police intervened, and immediately he was arrested, and immediately it also happened that he was prosecuted in accordance with the Older Persons Act, which is one of the few new cases going that way. So I'm very happy to see that the justice system is taking the route of the Older Persons Act when they prosecute and when they actually do handle these cases. Further services that we render is also through our local offices. Ms. van der Renen could expand on that if she would like to, but the basic bottom line is any case of abuse that's been dealt with or that we pick up, our regional officers, social workers will also intervene and provide necessary support. Another form of abuse that we do come across is specifically with older persons that actually do become homeless. So that's another matter where we try and see if we can find them accommodation in old age homes that do cater specifically for SASSA beneficiaries. So there's a lot of work going into the prevention and the support of elder abuse. I think just as a last statement on abuse, the very difficult thing is that a lot of these cases are not reported due to the fact that it takes place in the house. And a lot of older persons is not very willingly to come forward to actually lay charges due to the fact that it involves their child or their grandchild. So that is a very difficult thing, but we do awareness to actually inform them. Also, this kind of awareness takes place at the service centers that we fund. At these service centers, there will be lots of awareness on the abuse, their rights as older persons, and what help they can get and where they can go to. On the Beacon Vale, we have done various investigations. There was specifically one from a norms and standards viewpoint and a health and safety standard. So there was some issues with health and safety at specifically the old age home. We have put in place a service delivery improvement plan, and we've got also responses of this plan that the chairperson and the management of Beacon Vale are busy implementing. So this plan of looking specifically at health and safety issues, as well as certain health norms and standards, are currently being monitored by this department. I've recently seen also a quote that they were busy with trying to improve some health and safety issues within the old age home. So that's that in a nutshell with regards to that, but just to confirm that we are monitoring them very closely with deadlines on specifically the implementation of the findings that we got there. Thank you.
Thank you very much, Mr. Jordan. And then with regards to the specifics, we are obviously most welcome to engage with the department through the various parliamentary channels. Ms. van der Renen, thank you so much, Mr. Jordan. Ms. van der Renen, anything you would like to add?
Thank you, Chairperson. Maybe just to add from my side is we also now have included the investigations into the older persons as one of our indicators in the annual performance plan. So we will monitor that on a quarterly basis as a result of the increase in that. Thank you.
Thank you very much, Ms. van Renen. Member Stevens, I saw your hand. I just wanted to inform you that I will get back to you. We're just dealing with Member Windvogel's questions. That deals with the protection of the elderly. Member Windvogel also had a question on page 319 with regards to substance abuse, an update on the master plan and the LDEC local drug action committees on municipal level. And then there was also the question on page 322 with regards to table 9.5, poverty alleviation. Minister or Dr. McDonald?
Thank you, Chairperson. On the question regarding the status of the local drug action committees, there are 13 fully functional local drug action committees in the province at the moment. And then there's 12 NGOs that haven't got functioning local drug action committees at the moment. The district municipalities don't have local drug action committees, since that would essentially duplicate what the local municipalities are doing. So the municipalities that do have functional local drug action committees are the City of Cape Town, Stellenbosch, Litzenberg, George, Shesakwa, Knysna, Mossel Bay, Cape Agulhas, Swellendam, Theowaterskloof, Matsakama, Saldanha, and Swartland. In terms of the National Drug Master Plan in general, I think the province continues to roll out the Provincial Master Plan in relation to the National Drug Master Plan, and we are that work is ongoing and aligned, and we report regularly to the Central Drug Authority on the activities of the province in that regard. The question on Table 9.5, the reduction in budget for sustainable livelihoods, and what the background to that is, I'll ask Mr. Hewu to speak to that.
Thank you very much, Dr. McDonald. Mr. Hewu.
Thank you very much, Jody, through you, Chair. Chair, in actual fact, it's not necessarily a reduction in the budget. We transferred just towards after the adjustment budget, we transferred 2.3 million from the sustainable livelihood to social relief to buy food parcels, because we're under pressure because with the demand for food relief increased. So as a consequence of that, we had some money that was available under sustainable livelihood and poverty, and we transferred that money to buy food parcels. So in actual fact, it's not a reduction in the budget. I hope that clarifies the matter for honourable member. Thanks, Chair.
Thank you very much, Mr. Hewu. Member Winfogel, are you covered? Do you have any follow-up questions specifically on those?
Thank you, Chair. No, I'm covered. Thanks, Chair.
Thank you. Baie dankie, Member Winfogel. And then Member Stevens.
Thank you, Chair. I think most of questions was covered, but on that same note, I would just like to know what special services or programs are available to the older persons, especially in the rural areas, and also when it comes to drug-related issues for our youth, and not only for the youth, for the adults as well. And then lastly, I just overheard about the drug master plan officers, if they can make, the department can make that available, in which areas are these drug master plan officers, and maybe contact details for them if possible. Thank you, Chair.
Thank you very much, Member Stevens. I've made a note on my side. I'm sure the procedural officer has done so as well, for us to, in our deliberations on resolutions and recommendations, to just get the necessary information with regarding to that. That's your latter comment, and then I will just ask either Minister or Dr. McDonald to respond to your first question.
Thank you, Chairperson. So the programs that are available for older persons in rural areas, there are older persons service centres and older persons clubs, which are often linked to the old age homes, but also are run by the older persons themselves in different areas. And we've also got organisations like Meals on Wheels that are providing support. Those community-based services for older persons are really to assist them with healthy aging and with some nutrition and also some social contact in their communities. Unfortunately, those programs have had cuts, quite significant cuts in the last 3 years as a result of the budget implosion after the COVID disaster. So there has been reductions in those programs, but there are still those programs running. And then, of course, there are a range of other services for older persons as well, like the residential care for older persons, particularly frail older persons, and community-based residential programs that are being piloted at the moment, where the special housing is allocated for older persons so that they can continue to live in the community as opposed to being shifted into a facility. So we try to offer a continuum of care for older persons as far as possible, where we try to help them stay in the community and with their families as far as possible, which is the objective, one of the primary objectives of the Older Persons Act. But where older persons are unable to care for themselves, then we fund the frail care in facilities. The question around programs for adults and youth with substance use disorder, those programs are including preventative services, education and awareness services, and then also early intervention services, mostly rendered by our local offices, where our social workers do assessments of people potentially needing interventions, and there are various types of services provided to those people, and then the more formal types of drug treatment programs, whether they are community-based or whether they are residential drug treatment programs. We offer those residential programs, mostly service the rural areas because the distances are too great for community-based services, which would involve people commuting in. But there are some community-based services in some of the smaller towns in the province. And then there is also aftercare services and reintegration, which is done by our social workers to help people who've come out of rehabilitation programs to adjust back to being with their families and communities and help them to avoid relapsing. I think the last question about the drug master plan, there's not. I think maybe the term is there aren't drug master plan officers. There are local drug action committees, which are set up in terms of the drug master plan, and those are run by the municipalities. So, but as the honourable chairperson has mentioned, we can provide a list to the committee so that you can refer properly to it, because it's too many to run. I ran through it very quickly, but we can provide the details. Thanks, Chair.
Thank you very much, Dr. McDonald. Perhaps just also Member Stevens, after our joint oversight visit to the Central Karoo, we've also made provision within our committee program to have the older persons fraternity invited, as well as the department. We will just, as a committee, have a look at a suitable date within our program, but that is also on the cards, and I'm sure then we can also further dissect in terms of programs and support accordingly as well. Can I ask Member Stevens, are you covered? Do you have any follow-up questions?
I'm covered, Chair. Thank you.
Thank you very much, honourable members. Members, are there any new questions on pages 310 to 323? I don't see any hands. Thank you, honourable members. We then move over to pages 324 to page 325, of which page 324 stipulates point 10, which deals with other program information, table 10.1, personnel numbers and cost. 325, page 325 deals with training, table 10.2, which is information and training. Members, do you have any questions on pages 324 and 325? I do not see any hands on my side. That means there's no questions on those pages. Members, and as mentioned at the beginning of the meeting, pages 326 to 339. There are annexures. Are there any member wishing to ask a question on those pages? No hands. I assume there's no questions on that pages then. Are there, Ms. Jamke, please assist me. Are there any members of the public or stakeholder organizations present that wishes to make a submission on the budget and ask any questions?
No, Chair. There are no members of the public present.
Thank you very much for that confirmation, Ms. Jamke. Member Kamfer, I see your hand.
Yes, Chair. Thank you, Chair, for the opportunity. Chair, I am 3 questions from page 23 to 7 until 337.
Pages 327 to 337. So covering that
Yes, Chair.
pages, you have got 3 questions.
Yes, Chair.
So will you just direct us in terms of your first question, on which page it is, as well as your second and your third question?
Thank you, Chairperson.
Thank you very much.
Chair.
You may proceed, Member Kamfer.
Thank you, Chair. Page 3 to 7 is table A2. That is according fleet service, Chair. My question is, why is the budget fleet service decrease, Chair? That is my first question. Secondly, Chair, is there...
Excuse me, Member Kamfer, can I please ask you to just repeat that question?
Chair,
pertaining to the fleet services?
Why is the budget fleet service disgrace die begroting aan die vloot, Chair, is verdienste, die fleet services rondom die transport, Chair?
Yeah.
And my understanding is that it is for the persons, that is for our staff, Chair. Waarom is die begroting vir die vloot afgeneem, Chair? Tweedens is daar voorsiening gemaak vir die sekuriteit gegee die teiken en die kaping in daardie verband by die hotspot areas. That is my first question in page 327. My second question, Chair, 334. Kant is table A4, is tabel A4. Kan die departement duidelikheid gee oor waarom die begroting vir die metro 10% is, Chair, terwyl ander munisipaliteite minder as 4% ontvang het. Ek verwys spesifiek na Cederberg in die geval. 337 tabel A 4.4. Watter formule gebruik die departement om hierdie begroting aan die munisipaliteite goed te keer dat die metro altyd die gunsteling is, terwyl jy sit met munisipaliteite, in my opinie, soos jou Ouwerburg, wat ander befondsing is, onder befondsing is. Thank you, Chair.
Thank you very much, Member Kamfer. I will then hand over to either Minister or Dr. McDonald to respond to the 3 questions on pages 327, 334, and 337.
Thank you very much, Chairperson. The first question about fleet services and security in the hotspot areas, I will ask the CFO just to speak to the fleet services. In terms of security, We have been working on unmarking vehicles because they seem to be targeting government garage vehicles in some areas. So for those areas, we've been unmarking vehicles and we've been shifting to vehicle models that are less in demand by hijackers. And also removing the government number plates as well to try and make it less conspicuous. So those are some of the safety measures that we're trying to put in. There are trackers on vehicles as well, which are used to track if there is a theft or hijacking. But I'll ask the CFO just to speak to why the budget has changed for the fleet services there.
Thank you.
Thank you, HOD. Thank you, Chair. Just in terms of the fleet services, what we found in the 24-25 budget, there's been quite a number of rentals, GG vehicle rentals. And when you rent a vehicle, you don't pay fleet services kilometer expenses. It goes directly as part of the lease, which is disclosed differently. And for the new year, we've now picked up that taking those into consideration, that the requirement for fleet services or kilometer travel, as we put it, is going to be less in terms of the operational plans for the department, and therefore you'll see it's almost an even allocation for the 25-26 financial year. The trade-off will be then against our finance leases, which lies in as part of our capital expenses. And that's just a balancing act in terms of how we disclose it in our books. Then on page 334, the metro and then the percentages that we allocate towards that. Our financial systems are based on the location or the site of either an NGO or our offices. Therefore, if an office is located in the metro, although it renders services across the province, it will regard, and that's the category that we have, those as expenses that's allocated to the metro. So we'll have these cross-border services, and we have a number of NGOs that render services across the Western Cape. However, their location and where their office are located is within the metro in itself. And therefore, you'll get this picture that it almost gives the perception that all those funds are only specific for the metros. Unfortunately, we do not have a system that can break it down into further categories in terms of the services itself. And the same would then apply in terms of the formula for on page 337, as indicated by Member Confer. Thank you.
Thank you very much, Mr. Holly. Can I just follow up, Member Confer? Are you satisfied? Do you have any other follow-up questions based on the three initial questions?
I shall like to see how the department allocate. I understand what the administrator say to us or to me, that is no for one specific offices in the metro. So I shall see how we allocated the difference. Is there, if it can maybe show to us how we allocated to the different areas in the metro. Thank you, Chair.
Thank you very much, Member Comfer, and I'm sure the procedural officer has made a note in that regard as well to extend the request for further information to the department itself. Honourable members, I do not see any further hands. That means that you have exhausted your question based on budget vote 7 for social development this morning. And at this point, I'm going to ask, and also in the absence of any stakeholder organizations or members of the public wishing to make submissions on the budget or ask any questions, we have now come to almost the end of our session. We still have some committee business that we need to attend to in terms of adopting our report, as well as 2 sets of minutes as well. So Minister Lund and HOD Dr. McDonald, your various teams, thank you very much for obliging to the standing committee this morning and addressing those very pressing issues that members had in terms of the budget. Minister Lund, HOD McDonald, I'm going to ask you to make your closing remarks accordingly, please. I'm not sure who's going to go first. Perhaps Minister wants to have the last say, then I will then recognize Dr. McDonald.
Let's go for the elderly first, and then I can go after the HOD.
Thank you very
Sure.
much, Chair and Minister. It's not often I get referred to as the elderly, but yeah, I better start getting used to it, I guess. Yes, thanks very much, Chair. I think just to add to on that last point, there's always going to be a skewing towards the metro in our numbers because a lot of the NGOs that service the whole province have their headquarters here in the metro. So where you've got big organizations like RCFF here in Batisa, they've got old age homes in lots of small towns across the province. They've got child protection organizations all over the place, disabled, etc. So they're servicing municipalities across the province. But when we pay funds to these kind of organizations, we pay funds to their head office, which is in the metro. So it does create a impression that we are only funding the metro, but actually it's for the whole province. So it does make things a little bit tricky. But I think that's we can provide more information if the committee requires it. But thank you very much to the committee for the attention to our budget today, and for the oversight and also the support for what we're doing. We do appreciate it, and we appreciate the committee raising the areas of concern that are equally areas of concern for us as a department. And I think we have a mutual interest of putting these issues on the table for scrutiny by the public. So thank you very much, Chairperson and honourable members.
Thank you very much, Dr. McDonald. Minister Lund.
Thank you, Chairperson. Yeah, you can joke about some things when it's not true. But yeah, I also want to say thank you to the committee members. I know you are having a rough week this week, serving on several committees, so I'm not going to keep you too long. And also then this specific vote is going to be at almost the midnight shift, the last budget vote on Friday. But I thank you for the way you have interrogated us, worked with us, and looking forward to the year working with each and everyone together. And then lastly, to the staff, both in my office and in the department, thank you for always keeping the bar very high and making it maybe a little bit easier for the committee to do oversight over us. Thank you so much.
Thank you very much, Minister. Again, thank you to all honourable members. Thank you, Minister Lund, HOD McDonald, all departmental officials. We don't have any guests this morning. Thank you so much for your time. Thank you for your valuable efforts. And I believe the next time we see each other will be in the House. Thank you so much. You are now welcome to exit the meeting. Much appreciated.
Thank you, Chairperson.
Thank you.
Chair. Thank you.
Thank you, Chair.
Thank you, Chair. Bye,
Thank
everybody.
you. Bye-bye.
Members, then we will then stay behind and for the finalization of our committee report. Honourable members, we will now adopt and consider our committee report on vote 7, social development. I will now ask honourable members for any support or non-support for vote 7 budget. . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . And on the screen, you will see the draft committee report. Let me just check the order of hands. I will recognize Honourable Member Van Minnen.
Thank you very much, Chair. I just want to say that I support this budget, and I particularly want to note the increases that are contained therein. I think that they are a very welcome item, and I think that it's a very good thing going forward. And I hope that, given all the travails of budgeting at the moment in South Africa, that we are able to go forward with this. Thank you.
Thank you very much, Member Van Minnen. And then I recognize Member Boysen.
Thank you, Chairperson. Chairperson, I'm raising my hand to second the proposal made by Member Van Minnen to support the budget. Thank you.
Thank you very much, Member Boysen. I recognize Member Van Wyk.
Yes, thanks, Chair, for the opportunity. I would also like to support the budget and what we've seen here today, and I think it is certainly quite heartwarming to see that the budget for social development has been increased by 8.07%. I think in the very difficult circumstances that we are finding ourselves with the fiscal constraints and with the budget, it is certainly very good to see that increase of something over 200 million that has been allocated to social development. So we certainly hope that this will start helping relieve the pressures that have been on this department. Thanks, Chair.
Thank you very much, Member Van Wyk. And then I see Member Stevens.
Thank you, Chair. As from the Patriotic Alliance, we support the budget. Okay, thank you.
Thank you very much, Member Stevens. That then deals with the hands raised. I see Member Van Vogel. You may proceed, Member Van Vogel. Member Van Vogel. Member Kamfer.
Thank you, Chairperson. Chair, die ANC component gebruik ons minority vote, rule 90, en support nie die budget nie.
Baie dankie, Lid Kamfer. Ons neem kennis. I recognize Member Kassim.
Thank you, Chairperson. Just for record purposes, you can note down that the EFF also does not support the budget. Thank you.
Thank you very much, Member Kassim. We will then just give an opportunity for the procedural officer to amend the draft report so that I can officially table the report and ask for adoption thereof. Honourable members, as on the screen, committee report of the Standing Committee on Social Development on Vote 7, Social Development in the Schedule to the Western Cape Appropriation Bill, Bill B2 of 2025, dated the 1st of April 2025 as follows. The Standing Committee on Social Development, having considered the subject of Vote 7, Social Development in the Schedule to the Western Cape Appropriation Bill, B2 of 2025, refer to it in accordance with Standing Rule 188, reports that it supports the vote. Minority view, in accordance with Standing Rule 90, the African National Congress and the Economic Freedom Fighters expressed their minority view to not support the vote. Honourable members, if that is the true reflection, can I please ask for a proposer and a seconder to adopt our committee report? I see Member Van Wyk and then Member Van Minen.
I propose, Chair.
Thank you very much, Member Van Wyk.
And I'm happy to second.
Thank you very much, Member Van Minen. Our committee report on budget vote 7 are then duly adopted and recorded. Honourable members, that deals with budget vote. We have 2 sets of minutes that we need to adopt. I think it's the 11th of February and the 18th of March, if I'm not mistaken. You have been furnished with the 2 sets of minutes. If we can please just have those beamed up. Standing Committee on Social Development, our minutes of proceedings for Tuesday, the 11th of February 2025. Members, please do check your attendance on the first page. We can move to the second page. Our quarterly reports for the periods July to September and October to December 2024, our tracking document, committee program, and 3.1 are the SASSA stakeholder engagement. Honourable members, are there any amendments from your side, or are you happy that this is the true reflection of our meeting on the 11th of February 2025? If that is the case, can I please ask for a proposer and a seconder? I see Member Van Minen and then Member Stevens.
Thank you, Chair. I'm happy to propose.
Thank you,
I
Member Van
second
Minen.
that. I second that, Chair.
Thank you very much, Member Stevens. Honourable members, our standing committee minutes for the 11th of February 2025 are then duly adopted and recorded. Please see the meeting minutes for Tuesday, the 18th of March 2025. Please do check your attendance. We can move to the second page. And this is the meeting where Post Bank tendered their apology due to their outreach programs, and we had SASSA briefing the committee on the latest developments at that time. We can move to page 3. Thank you very much, Ms. Jamke. Honourable members, are there any amendments to this minutes? I do not see any hands. In the absence, are you happy that that is the true reflection on the 18th? I see Member Van Minen.
Happy to propose.
Thank you very much, Member Van Minen, and I see Member Van Wyk.
I second that. Thank you, Chair.
Thank you very much, Member Van Wyk. Honourable members, then our committee minutes, standing committee minutes for our meeting on the 18th of March 2025 are then duly adopted and recorded. That deals with our administrative issues, or rather committee documents this morning. Ms. Jamke, are there any other outstanding issues that the committee needs to deal with this morning?
Yes, Chair. Any resolutions from the members based on the budget?
Of course, yes,
Chair,
Ms. Trumke. Yes, thank you so much. Can I ask perhaps what you have jotted down and that members can just fill in?
Okay, it's a request for information, Chair. The first one is data on child-headed household in the province. I'm not sure if that is still required by the members. Then the second one is data on children in state-funded ECDs, a detailed list of local drug committees, then a comprehensive information on the funding allocation for NGOs in both metro and rural areas. That's all, Chair, that I managed to capture.
Thank you very much, Ms. Trumke. Members, are there any additional information that you require? I don't see any hands. It seems like you have captured that sufficiently. Ms. Jamke, can I just ask that we also just resolve for us to, after we have perused our committee program, see how best we can fit in to invite the interministerial committee on food security to our standing committee. We obviously won't be able to determine a date at this point, but we will have to scrutinize our program and see how best we can put that engagement in place. Is that in order, members?
Yes, Chair.
Thank you very much, Ms. Jamke.
Yes, Chair.
Satisfied? Honorable members, then that concludes our business this morning. Thank you so much for your robust and very productive engagements this morning that deals with our business. All the best for the remaining votes. And you must have a most blessed week, Ms. Jamke, and our other procedural support staff members. Thank you so much for the incredible work that you are doing as well. I wish you a most blessed week further. Thank you very much, members. Our meeting is adjourned.
Thank you, Chair.
Thank you
Thanks,
very much,
members.
Chair and members.
Thank you, Chair.
Thank you.